Hello. So I understand a number of you are interested in interpreting, medical interpreting specifically. What a lovely idea. Now, I will be publishing a series of videos detailing absolutely everything that I know about interpreting. But I need your help. I would like you to send me your questions about what you would like to know about interpreting. I also have a question for you. Why do you want to be an interpreter? What is your goal? What excites you about the profession? Keep that thought. And today, we are just going to chat. We're just going to talk. I'd like to take you with me on a journey of a typical day interpreting. I'd like to paint a very good picture for you of what a day looks like interpreting. You ready? Great. Let's go. So let's say we have 4 patients, okay? Let's say the first patient is for an eye surgery. Let's say the second is for a urology appointment. Let's say the third is for a cancer patient. And the fourth is for a psychiatry appointment. Sounds good? Great. Let's say the eye surgery starts at 6 a.m. Well, we will arrive 10 minutes early approximately. We will present ourselves to the registration department. We will tell them who we are, where we're coming from, that means which organization we work with, and give them the name of the patient or the medical record number. It's more private, but the last name is fine. Now, if the patient is there, they will let you know. If they are not, they will ask you to be seated and wait. When they arrive, they will let you know. Let's say the patient is there. So we will go and present ourselves to the patient. We will tell them about our name and where we're coming from. And this is a really good time to set some boundaries. This is the time also to tell them that you will be interpreting everything that is said, that everything will be private, and that you will be coming in with the staff to the room to interpret, and you will be leaving with the staff when they leave. Okay? This is also a good time to ask the patient where they're from. In my case, my mind is like a radio, and I have many channels. So I need to know what the patient dialect is to prepare myself mentally. I don't know, it's, the choice is yours, but this is how I work. And also in our countries, and I am specifically talking to Arabic interpreters, we have many dialects. And some of them are more challenging than others. And everybody knows that the North African dialect is the most challenging. That's because the people of North Africa are from, most of them are from Amazigh, or that's their dialect, and that's their origin. And Amazigh is a completely different language, has nothing to do with Arabic. Now, most of these people can speak Arabic. However, they don't understand all the dialects, all the Levantine or the Egyptian dialect. They don't understand. So what they do, some of them, is they say, we speak French. I interpret for them, I interpret French. So they will say that to avoid having this issues with people not understanding what they're saying, or interpreters not understanding what they're saying. But some of them speak Arabic, but with an accent. So if you want to be an interpreter, you need to train your ear to hear and to get used to their dialect. There are plenty of YouTube videos, but also I am sure you have Moroccan neighbors and Algerian neighbors. Ask them to teach you, talk to them, learn from them. Okay? So let's say the dialect is not a problem and everything is fine. We are going to go ahead and interpret for this patient. We are going to be called by registration. Registration is going to be asking them about their health status. They're going to ask them to sign the treatment consent, the billing, their consent. They are going to also give them the patient and rights and responsibility form. Now, this form is basically about how the hospital will treat them with respect and dignity and in a clean, good environment. Now, this also applies to the patient. The patient has also, to treat, need to treat the staff with respect and dignity, and follow the doctor's instructions so the outcome of the surgery is great. Okay? I have noticed lately something whereby some patients record in private the staff. In this form, it states that it is not allowed. Now, if somebody wants to take a picture or record something, all they have to do is ask permission. Most of the time, staff will oblige. But to do it in private, it's not okay. Anyhow, that's just something I needed to, talk about or mention. As I said, today we're just talking. Okay, let's say we did registration and they placed the bracelet on the arm of the patient, and we're going to sit and wait for the nurse to call them. When we sit, it's much better to take a seat a little bit away from them so that you don't get into a conversation with them. You don't know what they may tell you, and you don't want to be burdened by that, especially when you're first starting. Let's say the nurse comes and gets you, and the nurse will take you to the pre-op. When we go to the pre-op, that's where the patient is. They take their weight, their height, they may ask them for a urine sample, they show them their room or the bed, the patient will put the hospital gown, they will attach them to the monitor, they will attach their arm to the blood pressure cuff, and the nurse will go through their medical, the health history. They will place an intravenous, they may draw blood, and also at that time the surgeon may come and, the surgeon will come and visit them if they are having, since we're talking about the eye, they will mark their eye, and anesthesia will come, ask them questions. The nurses from the OR will come and ask them questions. There will be many questions and almost exactly the same. This is for the security of the patient. They have to do that. It's not to irritate anybody. And it's a good thing. So we will have to be patient. The patient has to be patient and appreciate that they're taking care to make sure that everything is right. Now, most of the eye surgery, let's say this is a cataract surgery, it's not going to be done under general anesthesia. It's going to be local, so that means they're going to numb the eye. And, maybe it depends. The surgeon may or may not give some kind of sedation to the patient. In this kind of surgery, we will accompany the patient to the OR. We are needed there because the doctor will still need to give instructions. The patient has to sit, be still, because this is a very delicate surgery, and our doctors can do it with their eyes closed, but I know they will not do it with their eyes closed. I mean that they're so good at it, they can do it, very quickly. However, they still need the patient to cooperate, and us being there kind of helps, we are not supposed to be there to, bring comfort and all that stuff, but for somebody, especially elderly, this is like a completely different language, completely different environment. It helps when we are there. So after the surgery, we will go to post-op. We may actually accompany the doctor to see the family if the family doesn't speak English and interpret for them. And once we finish, we go back to our patient. And in post-op is where the nurse will take care of the patient and watch their vital signs and give them something to eat and drink. And after that, they will detach them from the monitor and make sure that they are awake and they can, they are not dizzy, can stand. They put their clothes on, and we will go through the discharge information. The discharge is what they are going to do during the day and the night, what kind of how to take care of their eye, and the medication they will need to put on that eye, and all the precautions, and they will give them numbers to call should anything happen. And we do that with somebody present, because everybody who's coming for surgery should have somebody with them to take them back home, because even if they give them sedation, it's still sedation. They are still going to be disoriented. And after that, basically, we ask the staff if they still need anything. If not, and if the patient doesn't need us either, and the family member doesn't need us, we will excuse ourselves. And I will tell you that everybody will be happy and grateful, and we will call it a day and be on our way to our next patient. And I believe we said that's going to be a urology consultation. Okay, let's say this appointment is going to happen in the same building. So we will go. Now you are professional at introducing yourself. So you will go to the front desk, introduce yourself, and if the patient is there, you do the same. Now let me tell you about urology appointments, especially if you are a female interpreter. You may excuse yourself from these appointments, but staff interpreters cannot keep doing it. These are a little bit awkward assignments for both the patient and the interpreter, especially for people from our part of the world. We are very private people, especially when it comes to our bodies. Not like our African, brothers and sisters. They are not. They are pretty at ease about it. Now, you will go with the patient when they are called and interpret for the medical assistant, who will ask them questions about their health and take their vital signs. When she leaves, you leave with her, and then the doctor will come and have a chat with the patient. When the examination starts, when the doctor needs to examine the patient, I normally excuse myself and stand behind the door. When the doctor finishes, he will let me know, will open the door, and I go back in. Then the doctor continues and with the plan, and tell the patient, what he's going to do. If the patient is female, I normally just stand my face to the wall while the doctor is examining her. Now, these kind of appointments are sensitive and specific, specialized, so you need to come prepared. You need to come prepared with your terminology. You can't, you have to know what you're doing. Um, if I want to give you an advice, I would say when you have this kind of appointments that are unusual, prepare the night before. Learn the terminology for that appointment, because you may be faced with a patient who has a prostate cancer, or a patient who has erectile dysfunction, and one maybe the plan would be for surgery, and the other one for also surgery. For example, inflatable penile surgery. Will you have the terminology for all that? So be prepared. And I know you can ask sometimes, for the doctor to explain, but there's just so much explaining they can do. You have to have some raw material, some terminology to help you through this. Okay, so let's say we did everything just beautifully, and we will leave. We will help the patient with the checkout, or if they are going to go to get some lab work, we will go with them, and then we'll call it a day. After that, we said we are going to go to a cancer patient. Let's say the person has breast cancer, she was diagnosed, and she's going to see the team for the treatment plan. Okay, so the exact same thing. You are a professional. You're going to present yourself to the front desk and to the patient. These appointments, I must tell you, are heavy duty, very emotionally charged. You have to be in control of your emotions. You have to be an amazing interpersonal communicator, because you're going to be talking to the surgeons, to the medical oncologists, to the radiation therapy doctor. You have to come prepared with your terminology here again. And this is not the time to keep asking questions. This is the time for you to take the back seat and be as professional as possible, and be as immaculate with everything, from the terminology to your intelligence to your sensitivity. Absolutely perfect, because this is a life and death. You will see patients cry. You will see them at their most vulnerable. So this kind of assignment you take when you are so full of confidence, when you have the confidence to take them. So let's say the patient is going to meet with the medical oncologist, who will talk about the chemotherapy plan, medication, side effect, the whole saga. Okay. After that, she will meet with the radiation therapy doctor, who will also go through everything, the sessions, the side effects, and maybe she will have a simulation CT scan, whereby they put the patient on a CT scan and take the measurements exactly as they are going to be treating the patient. And also the patient will meet with the surgeon, who will talk about the surgery, if they're going to do surgery. And of course, in between all these, you're going to interpret for the nurses. Okay, so these are very long appointments. They are, as I said, heavy duty emotionally, and you need to be prepared for them. This is not the time to keep asking, please explain to me what this means and that means. And always, as an interpreter, the limelight is on the doctors and the patient. You take the back seat, you interpret, you will be so appreciated. Now, if you have a hunch that something is not understood, that something is, miscommunicated, something is not right, please say. They will appreciate it so much. Because remember, you are the one who can hear the original thought of that patient and the doctors. And sometimes, especially if especially that these kind of patients are so anxious, so worried. They cannot, sometimes I feel they don't hear you. So that's why you have to be present, so present. And what I mean by that is you have to pay attention to every word that is said and interpret it correctly. No telephone, in your hand, nothing. You are present, you are paying attention 100% to that patient. And I go back to the terminology. You may meet a patient who is a doctor from your own country. So that patient will be using sophisticated Arabic medical terminology. You have to match that to the English terminology so that the doctors are matching her register. You may also meet an illiterate person who's never been to school, and you have to match her register, the way she's speaking, so that the doctors and the staff bring down their register so that the understanding is clear. Because remember, one thing that I must tell you, you are not there to explain. No explaining. You are there to transmit the message as it is. Now, if the patient doesn't understand something, you will ask the doctor. You will say, if she says, I don't understand, you will say to the doctor, I don't understand. And it's up to the doctor to explain, or the nurse or the surgeon. Okay? Let's say we did all that we need to do. We asked if anybody needs any more of us. If not, we will excuse ourselves and we're going to leave. Are you exhausted yet? I am. So let's maybe go for a cup of coffee, because we may have like half an hour to go to our next appointment. Okay? All right, so we took some time, we had a nice cup of coffee, and now we are in the psychiatry department. Okay? At that appointment, we're going to do exactly the same thing, and you know what to do, right? You're going to present yourself to the front desk, you're going to introduce yourself, give them all the information about the patient, that they need to, so that they let you know if the patient is there or not. You're going to introduce yourself, and you know what to say to introduce yourself. Roughly, we will go through all this in next videos. And then you're going to go with this patient to see the doctor. The doctor will come out and, call you, and then you'll go with the doctor to the room. Now, the doctor will ask the patient about their mood, about their health, and if they have any side effects. Now, again, these are very specialized appointments. Again, these are the kind of appointments where you have to be a professional, but also a compassionate interpreter. You are not there to judge this patient. You are there to interpret for this patient like they are first-class citizens, like they're there's nothing different about them. But there is something different. These patients, because they are taking medication or because they are dealing with, trauma, they are going to be either speaking very slowly, and that's okay, that's easy for you to do because you can use your consecutive interpreting, which is 90% of what we do, and that means the patient speaks and then you interpret. But sometimes the patient is very anxious and they will be speaking very fast, and you may not have a chance to catch up with them. And in that situation, you will use a different mode of interpreting called a different mode of interpreting. Excuse me, I have to stop because I have somebody playing the guitar in the house, so we will catch up. Hold on for one moment.